Question number 2, Dr. Jackie Blue.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, does he stand by all his recent statements on health services?
The Honourable Tony Ryall.
Mr. Speaker, yes, including the statement that a new 25-bed ward was opened at the North Shore Hospital yesterday by Dr. Jonathan Coleman, which means patients won't have to wait so long to be admitted. This is in response to the 6-hour emergency department target. I can also advise, Mr. Speaker, that up to 10 of the beds will be available for acute stroke patients, and that means for the first time at North Shore, acute stroke patients will be located in the same part of the hospital, so it is easier to deliver specialist services in one place, improving quality of care.
Supplementary.
Dr. Jackie Blue.
What other developments are happening at Waitemata DHB that will improve patient services, particularly the Waitakere Hospital in West Auckland?
Honourable Tony Ryall.
Mr. Speaker, in the last few weeks, Waitakere Hospital has done hip replacement operations for the first time, and that will be followed later this year by other joint replacements such as knees being delivered locally. I'm also advised that Waitakere Hospital is launching 24/7 emergency services for children under 15 next month. This will further develop Waitakere Hospital as the local hospital for children in this area, and Mr. Speaker, that will save up to 3,000 kids and their families having to make the journey to Starship Hospital out of West Auckland every year. This is very positive news for the people of West Auckland, and I thank the local member Paula Bennett for her part in advancing health services for the people of Waitakere.
Dr. Jackie Blue.
Supplementary.
Order. I cannot hear the member. Dr. Jackie Blue.
Thank you. Does he stand by his recent statement that the new government inherited a lot of problems in Dunedin, including important building needs that had been neglected for years?
The Honourable Tony Ryall.
Yes, I can. And that is why the government has invested an extra $24.5 million in developments at the Southern DHB's facilities in Dunedin. Included in this is a new neonatal intensive care unit of 19 cots, replacing a cramped unit that would meet the standard for 3 babies. This will improve the privacy of families and allow more parents to stay with their babies. We're also funding $15 million for new acute mental health facilities at Waitakere Hospital. According to the Ministry of Health, Dunedin's Ward 1A mental health is the highest priority mental health unit for replacement in the country, and it's good that the people of Dunedin finally have a government that's prepared to invest in their hospital.
The Honourable Ruth Dyson.
Why did he tell the House yesterday that the Mid-Central District Health Board budget is $505 million when the budget document confirms that it's $408 million?
The Honourable Tony Ryall.
Mr. Speaker, because that member is not accounting for the additional electives money, the additional medicines money and additional services that will flow to district health boards. What that member doesn't want to appreciate is the fact that more and more people in Mid-Central are getting better frontline services from this government.
Question of the Honourable Ruth Dyson.
When he told the House that health cuts were actually health changes, what comfort will that be to a terminally ill person in Palmerston North who has been unable to find any alternative to the night shift district nursing service, an alternative service he assured the House was available?
The Honourable Tony Ryall.
Mr. Speaker, if the facts of that case are correct and the member makes it available to me, I will look into it. The hospice in Palmerston North is paid to provide those sorts of services.
The Honourable Ruth Dyson.
What will he say no to when the district health boards cannot continue delivering their existing level of services because of the budget shortfall? Will he say no to further cuts in services, deterioration in the quality of services, increased user charges or increased district health board deficits?
Mr. Speaker, what I will say no to those district health boards is to the culling of 30,000 patients who were promised surgery by that government and were summarily data cleansed from waiting lists.
Question number 3, the Honourable David Cunliffe.